Hello, this is Mr. McMurray back again talking about urine. How exciting. All right, urine analysis. If you want to find out what's going on in your body, two of the biggest ways to find clues of that are by taking your blood sample, because obviously if it's going through your blood circulatory system, it tells us a lot about what's going on in your body, and also what's coming out of your body, in particular urine analysis. Okay, so urine analysis and blood tests, they both have lots of different tests that they can do. There's usually at least 10 to 20 that are just kind of standard for a urine test or for a blood test, but there can be a lot more. There's just probably 50, 60, maybe more tests that they can run trying to find things out. So to diagnose what's going wrong with someone, blood and urine are two of the big things that they're going to test for, okay? Specifically, sugar, because that's a good sign of diabetes. That's something going on. Specific gravity has to do with how dense it is, which is really saying how much stuff is dissolved in it. Pure water has a density of 1 gram per milliliter. If it's more than that, that means there's more stuff dissolved in it, and normally urine would have that. But the more stuff dissolved in it, that would tell them a little bit about how concentrated it is, or getting plenty of water in it, and stuff like that. They actually have a little float thing that they put in the urine, and if it's dense, it sinks lower. If it's dense, it floats higher. If it's not dense, it sinks lower. And based on that, they can tell you how concentrated it is. Also, obviously, you can do drug tests if there's blood in the urine. Could be pus or infection-y type stuff in the urine. There could be various cloudiness or proteins that they test for, and these can all tell them something about what might be going on in your body, and therefore what might be wrong with it. Okay, and so urine analysis is very important for trying to figure out what's going on in somebody. All right, now if your kidneys fail, they're not working good enough to clean out enough urine, you have to go on, usually we just say dialysis. Technically it's hemodialysis. Hemo means blood, so basically you're taking your blood, dialysis means to separate, taking your blood out and separating the urine and stuff out and putting the rest of the stuff back in. If you remember earlier in the year, we made clear tubing, we made cells out of. That was dialysis tubing. All right, so basically they run your blood through this tube and stuff diffuses out of it, just like we had stuff that sugar and salt that dissolved through the little holes in the dialysis. Well, the urine and stuff will pull it out. Okay, now it takes a while. That's what it takes 4 to 8 hours to do that. Okay, and you have to do it at least 3 times a week. So if you're in dialysis, that's pretty much half your life is sitting around getting your kidneys done. This is not something you want to do for the rest of your life. Hopefully, it's just until you can get a kidney transplant with someone who's compatible enough that you won't reject their kidney. So hopefully it's not a long-term thing. But if you can't find a kidney, then yes, it could be a fairly long-term thing. All right, and it doesn't happen very quickly, so as this stuff goes through, some of it diffuses out, and it keeps doing that, running it through. Now, it's not going to do probably quite as good as your actual kidney, but you'll be good for a couple of days, and stuff starts building up again, and then, now, I don't know how much it's using pressure. It's mostly using diffusion, okay, going from high concentration in your blood of urine and stuff out into the liquid, and so it's why it's not quite as efficient as your actual kidneys would be. But it will do enough to keep you alive until hopefully you can get a transplant. All right, kidney stones. Kidney stones, or fancy name, is renal calculi. Calculi just means stones, counting stones. That's where calculus comes from. Don't ask me why. You can't just count stones with it. But anyhow, renal calculi are just, renal means kidney, so kidney stones, basically, which are can be made of different things, but most of the time they're uric acid crystals. If it gets concentrated in your kidney, some of it makes these balls and comes out of it. Now, that's not the only thing that can affect it, but that's one of the main things. About the only thing you can do to prevent it is to drink plenty of water so it doesn't get as concentrated. But there are some other things. You may be predisposed to them. If your parents have trouble with them, you're likely to have trouble with them, and so forth. But that's about all you can do to do it. To avoid it is try to drink lots of water. If you treat it with ultrasound, if they know they're there before they get stuck in the urethra or the ureter, usually it's the ureter coming out of the kidney, they can use it with, zap it with ultrasound. The ultrasound breaks it up into smaller pieces that hopefully will fit through the ureter. Okay, the ureter has a couple places where it gets thinner, and these tend to be the places where they clog up. They can be very painful to try to push through. I've always heard that they said for guys, it's the closest they get to the pain of childbirth. I don't know if that's true, but apparently it's pretty bad stuff. All right. Then it goes in the ureter. We said there's smooth muscles in the wall because it's a hollow organ. All our digestive system, but also our ureter has smooth tubes, and it helps push the urine down to the bladder. Okay. And the urinary bladder has transitional epithelial that contains stretch receptors. All right, transitional are the ones that they're short and cubic, the cells, but then when they stretch, they get spread out, and so they become squamosal. We said that if your transitional epithelial has become squamosal, that means you need to go to the restroom because it's stretching it out. Now, as it stretches, there's little nerve endings in there that are receptors that say, hey, it's stretching, and that's what sends you the message saying you might want to go to the restroom, okay? And so, and then your urinary bladder can only hold about 1 to 2 pints, okay? Pints, I believe the little milk cartons are half pints. So, yeah, it's about up to a quart maybe. But not half a gallon or a gallon, so there are limits to that. All right. And of course, some people's are bigger bladders than others. All right. Now, if a woman's pregnant, we'll talk more about this. But if the uterus is full of a baby in a womb, it's sitting right on top of the bladder, and that's why a pregnant woman will go to the restroom more often because there's just that much more pressure on it, and it stretches even if there's not a whole lot of stuff in it, urine in it. All right. Micturition. Or voiding is just a fancy name for when you go to the restroom, when you urinate, okay? All right. And between the urinary bladder and the urethra, there is, like I said, an involuntary sphincter and a voluntary sphincter. Okay, once it gets to the urethra, it's pretty much going to go out, okay? But there is a sphincter in between there. The voluntary is what we normally would use to decide when we urinate and whatever. But like I said, once again, if you couldn't go to the restroom for whatever reason, eventually your bladder's going to say, look, we're full, we can't hold no more. It's going to go, okay? And it does. All right. Urinary retention, okay? Sometimes you can't get all the urine out. That can be a problem, okay, obviously, because urine's kind of a poisonous substance. If it starts building up, the waste product starts building up, that's bad. In men, they have a prostate gland, like if here's the urethra, the tube going to the penis, there's actually a prostate gland which goes around it. It wraps around it, and it tends to swell up as you get older, okay? And it squeezes on that, and it can cut off the urethra, which means that the urine stays in the bladder, which obviously is not good. So to fix that, they would have to run a tube up the urethra, all the way from the penis all the way up into the bladder, okay? And that would allow it to flow out. Now, in women, the urethra is much shorter. It's only about 2 or 3 inches, I think. And so it wouldn't be as difficult to put the catheter up there, okay, and drain it out if you needed to. But it's very common in men. Generally, they say by the time you get 50, about 50% of the guys have trouble with it, 60% of the guys, 70%, and so forth. As men get older, it's pretty common. Hey. All right, so that's a very common problem with guys as they get older. They're going to have that kind of problem. All right, in the urethra, in males, we said that both humans and pigs, the path of the urine and sperm overlap, okay? But they can't. There's a little cutoff valve in there, so either sperm can come through or urine can come through, but not both at the same time, okay? And so in the urethra, it overlaps, kind of the urogenital thing like we talked about with pigs, where both the urine and sperm travel part of the same pathway, all right? And the urethra in guys tend to be about 20 centimeters long because it has to go through the penis and then up to actually to the bladder. All right. Now, in women, a little different. In the female pig, we said that both the vagina, which is the reproductive system, and the urethra open into a urogenital sinus, and so there's a common pathway where the babies would go through and the urine. But in humans, women do have completely separate openings. The vagina or birth canal and the urethra are completely separate. So there's never any overlap, which seems to be seems more hygienic to me, but it doesn't seem to bother the pigs, but they still have healthy babies. But at any rate, it's a little different in men and women. In the women, since there's no penis and stuff like that, the urethra is fairly short, 3 to 4 centimeters. Okay, long. And that probably also it's easier for guys probably to hold it if they need to go to the restroom, whereas women, it's right there. There's not much time in there to change it. So anyhow, but guys have fairly longer urethra, and women, it's going to be a lot shorter. All right, water balance or imbalance. A lot of your water, how much water you retain, how much you get rid of and stuff is controlled by your kidneys, okay? And one of the things that we talk about is diuresis, fancy word, but basically it means the flow of urine, okay? How much urine are you the process of making urine and having urine flow out. Now, diuretics are chemicals that increase the flow of water into the urine, or increase the amount of water, or increase the amount of urine. Okay, if people are retaining fluids, especially in their lungs and stuff, they may put them on diuretics, which are chemicals that increase the amount of water leaving the body. So hopefully the fluids in the lungs will, if there's less fluid, it will go back. It can also have to do with affecting their blood pressure. Blood pressure gets too high, there's too much fluid in your body, your heart is struggling to pump it all through. If we take some of the water out, then there's not as much pressure on the system, and so we can help use that to adjust blood pressure. All right. Now, if there's diuretics, there's also anti-diuretics. In fact, your body makes one called ADH, anti-diuretic ADH. Okay, in your posterior pituitary gland, which is up in your brain. Okay, and it releases this to make it more concentrated. In other words, it holds on to more water, so that makes your urine more concentrated. Okay, and so if you're perhaps short on water, or in a situation where you weren't using it, this would probably kick in and try to concentrate that so that you can hold on to more water in your body. Now, like I said, in medicine, in the hospital, they will give you a combination of these drugs depending which one they want. If they want more water in the urine, diuretics, which would raise your blood pressure and also increase the amount of fluids, or anti-diuretics, which would take less water into your urine, which would cause it to less water would lower your blood pressure. Okay, will it make sense? All right. Now the last thing is diabetes. Now we talked about diabetes mellitus, which is the normal too much blood sugar in your sugar in your blood. Okay. There's also one called diabetes, which has to do with flow. Diabetes means flow. In this case, which has to do with the amount of urine. In this case, you have so much urine, okay, it's because your body is not making the ADH, or anti-diuretic. So you're just putting lots and lots of water into your urine. You're losing so much water that you're going to be dehydrated. You may get low on electrolytes because so much of the electrolytes of sodium, calcium, and potassium are going out in your urine. So that's getting out of whack. Can cause a lot of problems, okay? And so to do this, instead of taking insulin to get rid of blood sugar, what you would do is get rid of, you would get some ADH or some drug that does accomplishes the same thing or does a similar type function, and it would cause your body to hang on to the water and concentrate your urine so it's normal concentration and you don't lose all these electrolytes and don't dehydrate. Okay, so that is diabetes insipidus. All right. Insipid, I think, means it sneaks up on you because it just all of a sudden you get started getting dehydrated and you're all out of whack. You feel bad. You don't know why. But anyhow, so that's that type of diabetes. Diabetes mellitus, Mellitus, means sweet or honey, and that has to do with the blood sugar level. All right. All right, other than that, I think that's pretty much it for the urinary system. And with that and the drawing, you should be, and you might want to use the drawing of the pig also, you are going to be ready for the urinary quiz, which we will have soon. All right, have a great day, and we'll see you sometime in May, maybe. All right, anyhow.